Can we all choose our seats, please? Carefully rephrase that. The next gentleman needs no introduction. You all know Dr. Klinghardt. The world knows Dr. Klinghardt. I know you've heard this before, but I first met Dr. Klinghardt when I was back in Michigan. I was director of a pain clinic, and I decided to go to a neurotherapy conference in Toronto, which was about 3 hours away. So I think we took a train up, or I drove, I wasn't sure, and there was a conference, and all these German doctors were up there. And I thought it was possibly the Fourth Reich starting all over again. But it wasn't. And I heard this young gentleman get up there, blonde hair, blue eyes, and I figured, well, maybe he's a clone of somebody, you know. But he talked about low back pain. He talked about simple therapies with injections and needles and local anesthetic, and he fascinated me. And I said, this guy has taught me more about medicine and pain than I had in my 5 or 6 years of medical school and 4 years of dental school. And I waited in the back of the room just to shake his hand, and he came by me and I said, thank you, doctor, that was an excellent seminar. And little did I know that years later we would be practicing together in Santa Fe. The gentleman, as you know, was a genius. There's not something he can't fix or know something about. I spent a year with him in Santa Fe. It wasn't supposed to be funny, but he has a great reputation in many fields. That was supposed to be funny. I had a great opportunity to work with him in Santa Fe for about a year until we both got booted out of the city by the powers to be for curing people. We're not supposed to do that, as you know. So the powers to be kind of made it plain and clear that it was time to leave that city, and I came to Reno at that point. But Dietrich and I have been in touch. As you know, it's very difficult to get in touch with him, and once in a while I see him once a year, and he still sends me patients. I know he's up in the Seattle area, and he's still alive, so I see him here. Getting a little thinner now, Dieter, aren't we, on top? So am I, don't feel too bad. That's why I'm still coming over like this, you see? You're coming back. You're up, buddy. God bless you. I'm very pleased to know you.
Thanks, Chris. I just wanted to say one thing about Chris. You know, Chris always comes across like a scientist and stuff, but like this was like about in 1992, he examined every patient that we had for Lyme disease. This is like 10 years ago. He was gung-ho on the Lyme disease issue, and I thought, well, you know, I knew that Chris was the best oral surgeon I've seen in the whole world, and I've seen many of them, you know, and certainly was, and still is the best oral surgeon that we have probably worldwide. But this Lyme disease thing, it took me 8 years or so to catch up with him on that. And it's amazing how now the whole world is finding this issue, you know, at the core of so many illnesses and so many problems. And so Chris, I take my hat off to you. Not that I ever had, but, you know, I take a few extra hairs off. I wanted to give you a little update on the jaw situation. So, just to catch those of you up who haven't been around very long, we've been in our field of alternative medicine. We look at the focal origin of illnesses very, very much. We're finding that very often a key piece in the body or in the soul or in the emotional body, if you resolve that, then the rest of the body straightens itself out. So we come from a school of thought that believes in the focal theory, not only of infection, but the focal theory of illness. And we very often find one single tooth. When you remove that, the patient's health bounces back. It doesn't matter if it's an ingrown toenail that gets well or a terminal cancer. But that one area in the body has been a kingpin. If you resolve that, everything around it unwinds and the body finds its way back to health. I've been very much limited by being a physician at looking at certain areas like the gut as a king piece, or scars in the body, or post-concussion states. The jaw, the function of the jaw was always very important for us, especially the vertical dimension, the height of the teeth. I'll get back to that as one of the key pieces in Lyme disease that we found. And the infections in the jaw were always an important piece of that. Root canal fillings were an important piece. And from addressing health in this way by finding certain areas in the body that we targeted, rather than giving a systemic treatment like it's done in conventional medicine, you always treat the whole body. You may find a pneumonia, but the antibiotic that you give is as concentrated in your big toe as it is in your brain, as it is in your lung. So you're always treating the entire organism. And with our therapy, we're trying to focus the treatment on one particular place in the body. And we've proven the issue over and over that this approach to illness is a very important piece. And so for me today to stand here and talk about the opposite and say, well, let's forget this focal theory of illness, let's look at the whole system, is sort of like a reversal of what I stand for in many ways. The first introduction to me of systemic causes of illness was my entry in the field of heavy metal toxicity, which was about 20 years ago. A few years earlier than most of you have sort of entered that arena. And that, staying with an issue allows you sort of to stay sort of ahead, at least, of most people, and makes you feel sort of competent in one area. And the heavy metal issue sort of has pretty much gone away for us. Because there's so many solutions now how to fix it, and we found a way of addressing that works, where we can reduce the toxic burden in people very easily and comfortably and reliably now. And we know it's been a cofactor in many, many illnesses, or all illnesses. And our inner group sort of that we are affiliated with, we pretty much have a feeling of, yes, this is an area we've solved. And now the whole world is suddenly talking about it, discussing how to best. They're still, they're just entering sort of the area of acknowledging that there's a problem where we already know, I say that humbly, we already kind of know what the solution is. Let them kind of follow, our course and follow the same holes, with the same mistakes, and then eventually we know that they're sort of going to come out in a similar, same place. Now, the same is not true for the area of systemic infections. With the area of systemic infections, we pretty much, through the surgeries and through the work that Chris has been standing for in this country, we pretty much got to the point where we saw, well, maybe 40–50% of people improve with the surgery by removing dead teeth, removing root canal filled teeth, reoperating the jaw in areas where there were extractions that hadn't healed properly. So a certain percentage would get well, and then an increasing larger number over the years, larger number of people had to be reoperated to get to the end point where they maintained their health. And then Chris was the first one to introduce me to the idea that these people not only having local problems in the jawbone around the diseased tooth, but that the entire jawbone, which is a spongious, hollow structure that has a vascular supply and has connective tissue, and it's pretty much like a hard sponge with hollow spaces in a normal state, that are all communicating, that infections are never just isolated around the tooth, but they're spreading throughout the bone. And if in conventional wisdom and medicine, it's well known, if you have an infection in one place in the body that has a blood supply, that you're going to find the infection anywhere else in the body also at different concentrations. And so we've been looking for a solution, first of all, for identifying which bugs are really making us sick and which ones aren't. And to start with, and this is sort of where we have one up on conventional medicine, conventional wisdom says that in a normal healthy mouth, you have 200 to 300 different microorganisms. This is the normal state. And in conventional medicine, it's virtually impossible to find out which one of these are causing the disease of the patient, because they're all present there at the same time, and there is no way of prioritizing, of kind of saying, well, out of these 246 bugs that we isolated, bug number 223 is the one that is responsible for the seizures of the patient. Yeah? That hasn't been possible in conventional medicine, and then we took the wisdom that had grown in Germany from using electroacupuncture as a diagnostic tool. Electroacupuncture, most of you know, is a science or is a medical diagnostic procedure that uses changes in the autonomic nervous system, which is called acupuncture system. I call the autonomic nervous system to stay within the terms of physiology. Uses changes in the autonomic nervous system to make, in an electronic way, through a phenomenon that's called the resonance phenomenon, a diagnosis. And it's possible to very rapidly and non-invasively scan through virtually thousands of kinds of infectious agents, thousands of toxic agents, food allergies, and so forth in a reasonable period of time. The problem with this procedure was that it, again, reflected only a systemic. The readings that you would get were really systemic readings, not really that was attempted in Dr. Fall's school to say, yes, these bugs are in the right jaw joint. But in the very nature of the readings, which you take off autonomically high innervated points on the hand, the reading was distant from the site of the infection, and it was highly vulnerable to interpretation of what the readings meant. And it wasn't until we met a guy in New York, Dr. Yoshiaki Omura, who is a surgeon who actually was on the medical board in New York for 10 years, who developed a version of muscle testing called the bidigital O-ring test. He uses the fingers. And he had the fortune, similar fortune to that what I have, that he stayed affiliated with his home country, with Japan. And as it is, the whole world is looking at the US, as the pinnacle of evolution. And when you come from Germany, like I do, and you're integrated in the society, and you go back to Germany and teach them, everybody listens. Because they want to know, what is it about the Americans that makes them so successful? And if nobody listens here to you, you go back to your home country, everybody shows up. All the professors from the universities, all the doctors you studied with, they all want to see, what is it that he has that I don't have? Why is he getting all the girls? And so Omura used the same principle and went back to Japan to introduce what he had discovered here to his Japanese colleagues. And the universities and medical schools that went gung-ho with this muscle testing method and validated a lot of the experiments that he did. And one phenomenon that is now worldwide pretty much accepted in all more sincere research settings is the resonance phenomenon between identical substances. And that phenomenon is very simple. It is when, for example, you have the liver is here, for most of you, you know that. When I take a piece of liver from a mammal, from a mammal that shares the same RNA, and put it over my liver, my autonomic nervous system immediately goes in a stress state, which I can confirm with the heart rate variability test that's out there, which is our instrument of choice now to validate a lot of the things we do with muscle testing. When I put a piece of kidney on the liver, there's no reaction in the autonomic nervous system. So, and I can put the liver in the space outside in the air,
and I still have the autonomic nervous system reaction, a stress reaction, sympathetic arousal and parasympathetic arousal. And this primitive phenomenon allows us to scan the body also for toxic substances. If there is mercury in my liver, all I have to do is wave a little piece of mercury in front of the liver in the projection area in space over the liver, and my autonomic nervous system goes in a stress state if there is mercury in the liver. Yeah? This is the direct resonance phenomenon. And the more I refined that, where we can also do that quantitatively. That means we can quantitatively say the concentration of mercury in the liver is so many nanograms per cubic inch using this phenomenon. And this phenomenon has allowed us suddenly to make a diagnosis of the exact infectious agent microorganisms in different body parts, in the brain, in the ear, in the eye, in the teeth, in the jaw, in the lung, in the prostate. And we found the information that Phil was just presenting. We found that experientially the same stuff, but of course having a non-invasive procedure that takes only a few seconds, we believe that we're probably 10 years ahead of most people and knowing what the significant bugs are that are causing different illnesses. And I want to limit my talk today on the jawbone, having used this diagnostic procedure, which we will demonstrate here. Having used this diagnostic procedure, we've scanned, between a few of us that are here in the room that use this procedure, probably thousands of teeth, and definitely tens of thousands of teeth, and probably thousands of jaw bones. And it's amazing that currently there is 3 bugs that stand out that are most common. When they are present in the jawbone, the patient has problems. They have either trigeminal neuralgia or cancer or chronic fatigue, or one of the serious new illnesses, fibromyalgia. When you find this bug, you have a sick patient. If you don't find any of these bugs in the jawbone, most likely the patient can still have a cavitation, they can still have a root canal, but they're not sick with it. So once we relate the occurrence of these microorganisms in the mouth with the actual symptoms of the patient, not all of the microorganisms in the mouth cause illness, but some of them do. And I'd like to start with Lyme disease. Lyme disease, we find in approximately 60% of all the people that have chronic illness and have cavitations or root canals or dead, devitalized teeth. And we find the highest concentration of Lyme disease in the pulp of the tooth, or if there's no pulp, in the lateral canals, in George Meinig's lateral canals of the tooth, we're finding the Lyme bugs. Now I have to say maybe one thing that makes this whole thing relative. Phil shared a piece of information that's very important, and that is that all the modern bugs, the stealthy bugs, the viruses and the bacteria and the fungi, exchange information with each other. When a bacteria like a spirochete has learned how to evade the immune system of the host, it not only celebrates that it sits there and eats, without being attacked, but it abundantly and generously shares this information, the trick that it learned, with all the other bugs that are passing by. And the sharing with the plasmids unfortunately occurs also between bacteria and viruses. So one of the things we have not learned yet, and the limitations of our techniques are in the testing material that we're using. We cannot distinguish if somebody has Lyme disease in the jaw or has a virus in the jaw that has picked up the stealth information from a Lyme spirochete. So we cannot distinguish between whether the DNA is really from Lyme disease, if it's really that's a complete bug, or if there's Lyme disease plus viruses that have picked up a piece of DNA or RNA from the Lyme disease, or a fungus that has picked this up. You're with me on that? So there's a certain blurriness in terms of the information we're getting. However, we know if you pick up Lyme disease, that Lyme disease is on board of this patient, and there's bugs in the jaw that have had sex with the Lyme spirochetes, basically. So that's why we can trace it. So Lyme disease for us, or the spirochete infections are very common in the cavitation area. Most common with TMJ related syndromes. So when somebody says I got TMJ, it for me means they got Lyme disease unless proven otherwise. And all the associated problems, the tinnitus, the eye problems, the facial, chronic atypical facial pain. I'm just restricting myself to this area right now. So Lyme disease, very common. The second common one, and unfortunately much more common than anywhere in the literature, is chlamydia. And both, all three types, trachomatis, psittacosis, and pneumonia. And chlamydia trachomatis, it's the venereal type of chlamydia that people I hear now, like in certain subgroups of the population. A man had the idea, you know, in the old days they went to a prostitute and did what you do with a prostitute. And then AIDS came along and they first, you know, did the condom thing, and now it has become sort of like common that men go to prostitutes and have oral sex. I don't know what they're getting out of that, but it's like, you know, that oral sex has become very common and to be a thing where there's a lot of promiscuity amongst men. And these men bring it home to their wives, and their wives kiss their children goodbye at night, and the children, you know, kind of slobber and drool around. And so chlamydia trachomatis has found its way fully into the saliva of large groups of the population. And we're finding it all the time. And we know when we treat it, the patient's TMJ syndrome goes away, the grinding in the jaw stops, the cavitations that seem to be so prevalent, we were just about to operate them, you know, to take 3 teeth out and operate like 2-3 cavitations. And we just did a therapeutic trial of 6 weeks on doxycycline with a few restrictions that we have on how to do this right, and all the symptoms are gone. And then they still have the cavitations, but the symptoms that we believe were caused by it are gone. So that's a very common one that we find, and I would say, how much, Doug? 30% of people with facial pain? It's not rare, it's not like 5 or 10%, yeah? We're talking something in the neighborhood of 30%. And then the next common group of bugs that we found independently long before we met Phil is the 8 herpes viruses. Let me kind of introduce you to the herpes family, because I don't think we've really have been properly introduced to it. So there's herpes simplex type 1, which is the one that typically causes the blisters on the lip if it expresses itself outwardly. This is the virus. Usually you get the blisters on the, this is important for you to know, you usually get the blisters when the virus gets uncomfortable in their home, which is in the neurons. When you did some intervention or some therapeutic thing or some emotional thing that suddenly activates the immune system and they go after the bugs in the neuron, that's when they start coming out on the lip. This is not when the immune system goes down, it's when it goes up, you get these viral outbreaks. This is also like an important thing. It can be either way, but it's very common when your immune system is actually active, the things appear on the lip. Then there's herpes simplex type 2, which is the one commonly associated with genital herpes. It's getting more and more common in the US. I read numbers the other day that they suspected that 60% of people that are teenagers now will have it within the next 10 years. Then there is the type 3, type 4, and type 5, which is cytomegalomy, Epstein-Barr, and mononucleosis. Yeah? So it's important for you to know that CMV, Epstein-Barr, and mono are also herpes viruses. They're part members of the same family, and they're all sharing with each other that they cause similar types of illnesses. And it's not that important to specify which one is doing what. And then we got HHV6, that's human herpes virus number 6. There's a very good book written on it that I recommend for all of you to read. It's called The Virus Within. Just came out a few months ago, and it's a great book to read up on the thing. And let me just kind of give you a little clinical thing. I want to throw in some clinical stuff. I saw this young woman, she's about 26, and she started seeing me about 3 months ago. 2 years before, she had a baby that died at age 4 months. She was born fairly healthy, got a few days after birth sickly, and sicklier and sicklier, went through all the universities and all the workup. They couldn't find any metabolic disorder or anything else. And at 4 months, the baby, to the day that the baby died. She got pregnant again, later thinking, well, that was a fluke and I was going to go for it again. This baby, when I saw her, unfortunately, the baby was already 3 months old and had like about 200, 400 seizures a day, and was, hadn't developed at all since birth. And I had just read the book on herpes type 6. And I said, well, let's look at the viruses. And I don't know how to take baby blood from a 4-month-old baby. You have to admit it. It's been like 50 years since I've been in a pediatric ward. And I said, well, no problem. We just send it back to her pediatrician, have him draw the blood, and do a herpes virus panel, to see where we are. Pediatrician refused. The baby went on to die, shortly afterwards, in a pediatric ward, and we could not get any blood drawn from this baby until we bribed, like a nurse at the place, post-mortem, to reserve like a vial of blood for us. Like, get to the end of the story. Meanwhile, I'd already had, with muscle testing, with our procedure, diagnosed both husband and wife, both having human herpes type 6 and cytomegalomy. We did the PCR testing on them. Both were grossly positive with astronomical levels of both of them. And when we got the blood back from the baby, it was herpes type 6. And I know if we could have made the diagnosis in time, we could have put her on IV antivirals if we would have gotten the cooperation of the people that were basically taking over care, and could have saved the baby, because I've done it in Germany a few times. And we're going to hear more and more about those cases. In the book, there's a few cases in that kind of give the impact of that, and we heard today that HIV, it's been absolutely my observation, is that HIV is a synergistic effect, or AIDS. AIDS only happens if there's a synergistic effect between HIV and HHV6, human herpes virus type 6. If those two come together, you get AIDS and you go down the normal drain. And those magic 10 or 20% that never get AIDS, those are exactly the people that don't have the human herpes type 6. And the moment they get that one, it's downhill from there. And so we find the herpes viruses in the jaw all the time. And our feeling currently is that the moment a cavitation becomes a focal area causing seizures, cancer, bowel disease, kidney disease, any of the other things, is if you have one of those two bugs, Lyme disease or the chlamydia, and then one of the herpes viruses joins. Then you have the synergistic effect that then triggers a full-blown illness. And so we've been looking at the diagnostic procedure. I show it's simple. I mean, you can do the blood testing and all that, but it still doesn't prove diddly-do that the herpes virus, when you find it in the blood, really is in the tooth. Right? You either have the tooth out and send it to, Joanne or to somebody, to make a local diagnosis. And as far as we know, that our muscle testing procedure right now is the only procedure. The interesting thing is that I'm working on an HIV device, that is really practically ready, where we can demonstrate the direct resonance phenomenon in real time. That means I put liver over liver. I get a reading on the instrument that shows, yes, this is identical to what I got here, and you can already do all the toxins with the machine, and that's going to be ready. So people are not going to have to depending on muscle testing for the rest of your life. There's going to be better ways of doing that. Okay, I'd like to just kind of stop for a moment. Are you sort of following me a little bit? I'm sort of giving you sort of like a way we've been weaving through this field. And I know Chris, Doug, there's a lot of people here that are way ahead of me in this, the way they've been approaching this. The next step for us was, once we knew how to make the diagnosis, was, well, what treatments work and which ones don't work. And my position is very clear. The illness-causing effect of the cavitation is always caused by more than one bug. It's a synergistic effect of 2 or 3 significant ones, and then probably hundreds of insignificant ones. And it's a synergistic effect of them working together, hand in hand, that makes the patient sick. And it is an illusion that you can find one thing that's going to get the patient well. We all tried that. So we've tried the antibiotic route, and Chris is probably one of the world's best people, like in asking which antibiotics he's explored, which ones work. I always followed his advice on that. He uses IV antibiotics for the more acute situations. And Zithromax has emerged for us as one of the, if there's a Gauss curve of which antibiotic hits most often, the most heavy bugs in there, Zithromax would be sort of in the middle of the hitting range, not by accident. Zithromax is better, azithromycin. But we overall, most of us were disappointed with the use of antibiotics over time. It most of the time gives people temporary relief. It shows, yes, it is an infection, and diagnostically we can use it. We put somebody on heavy dose of antibiotics. If their illness improves, we know, okay, we're on the right track. But then I've never been able to take that all the way through to a cure. It has just not done that. And so what we are exploring is an approach where we use several things together, several approaches together. And I want to take you there and kind of show you quickly like some overheads with some of the cocktails. So let me see if I can find the thing I wanted to show you. Now, let's just kind of do the Lyme disease thing first. I always start with removing toxic metals from the mouth and the body. So we embark everybody on a heavy metal detox program where we find metals. And we have a handout that was given to you that should be on your tables with my list of detox agents that I'm currently using. Do you guys have that? What happened? We had that printed. No, it has a list of agents, of about 30 agents stacked underneath each other. I think Carol Arana was in charge of that this morning. Carol, were you in charge of that? Okay, well, I show you the list, and then let's take you through that quickly, because it has changed like over the years and has improved, and I feel now it's like we have the best agents in the world around now that makes detoxing so easy. I'm just going to rattle this through. So there's there's IV agents. There's intravenous agents, DMPS, intravenous vitamin C and glutathione with the different schedules. Subcutaneous agent desferal, very important when iron plays a role, or copper. There's or aluminum desferal is fantastic for Alzheimer's disease. Needs to be given for a long time. There's a number of studies out on that. Then the oral agents, Garlic Plus is one of the things that Gary Gordon did. Gary Gordon is one of our friends who basically goes to every lecture that we ever hold, and then he puts everything that he hears lectures on together in one capsule, and that's his detox agent. But he's listened to the right people. One of the agents in there is D-L-methionine. It's available as a product called Redoxal. They're out here. Redoxal is fantastic to add that in with any detox program. Chlorella is the thing I'm heavy on. It's an algae that detoxes the gut. Cilantro detoxes the brain. Then we get to PCI and metal-free spray. Metal-free, the people are out here. Metal-free is contains a peptide isolated from chlorella, and is then packaged in liposomes and all kinds of things, and the company doesn't quite disclose how it gets to the end product, but metal-free is for all of us, has become the gold standard of heavy metal detox. It's gentle, you can use it safely on the most severely ill people, and the excretion is over the colon, it comes out in the stool, and we surround each program with a couple of cofactors, but PCA, which is another agent very similar to metal-free, that sort of is the core piece of our program, and everything else is an extra that we put around it. DMSA caution side effects may include seizures, MS, and schizophrenia. I just let that stand here. There is a whole website out on cautioning people not to use DMPS and use DMSA. Instead, DMSA is a very dangerous drug when you have a sick blood-brain barrier or when you have a growing child. Do not use DMSA loose-handedly just because it's in the PDR. It's the most dangerous of all the drugs that we have. Alpha-lipoic acid has become very popular in recent years. Whey, bovine whey contains, whey is from milk, contains branched-chain amino acids, which are very important as a co-substance in detox. A phosphorus trace mineral and electrolyte supplementation has become very important more and more. Basically, the basic idea behind this is that our body functions better with toxic metals than with no metals at all. We need metals for the electric system in the body, for conduction, we need it for certain enzyme systems. And enzymes, when they cannot get a copper ion or zinc ion, they may take a mercury ion or a zirconium ion and put it there, and the enzyme is still somewhat functional. It's a survival mechanism, and the most basic elemental way of detoxing a patient is to loading them up with good minerals, and the body will throw out toxic minerals in exchange for it. And one of the reasons, or the only reason I believe that heavy metal toxicity has become such a rampant issue is because our soils are increasingly more and more depleted of minerals, and because of that, our body is becoming depleted of minerals and therefore becomes a sponge for toxic minerals. It leaves us wide open. The protection for heavy and against heavy metals, you can eat all the fish in the world that you want. If you are in good mineral status, the body is not going to take in the mercury. However, the moment you're missing any 2 or 1 ionic mineral, any 2+ or 1+ mineral, the body's going to suck up the mercury salts like water and replace and saturate the tissue with that. So there's a couple of other things on this list. I'm still waiting for somebody to speak up that you found the flyer. Somebody has it in their bag. It was kind of this morning. You have one, Richard? Yeah. Somebody's making more copies or something? Okay. Because it's the best list in the world so far. That there is. It's complete. Everything else, there may be other things, is not that important. Freeze-dried garlic, I have the accessory agent. Freeze-dried garlic has become one of my main adjuncts, and I'll get into that in a moment when I talk about treatment of infection. Maybe I say that here. Recent research from England showed that garlic, first of all, one thing you need to know about garlic, when you start chopping it down, eat it, or cut it down, or make a pill of it, the main compound in garlic is 2 compounds, alleine and cysteine. Cysteine detoxes metals on its own, but alleine is a fantastic compound. When you chop it up, an enzyme is released called alleinase that breaks it down to allicin. And allicin is a group of compounds that is incredibly valuable as an anti-infectious agent. It's antiviral. It kills most pathogenic bacteria that have ever been studied. Like, for example, Helicobacter pylori is gone within a week of eating fresh garlic. 1 week. Most TB, most the anaerobes in the gut that we don't want to have, most the nasty bugs that we know of are sensitive to garlic over time. Also the larger parasites, like Giardia. Giardia elimination is impossible currently with any current medical intervention that I know of. It's not possible to get rid of giardia. Metronidazole has failed. You can't give it long enough without killing the patient first. Yeah? And then none of the other drugs have held up. Garlic eliminates giardia from the system. And those of you who are into microbiology, who have followed patients with giardia, know how important it is. Yeah? And so garlic kills most of the microorganisms in the mouth. All the pathogens that have ever been studied in the mouth are sensitive to allicin. Now, here comes the caveat. The but is that allicin has a half-life of maximum, it's different compounds create different types of allicin, maximum of 2 weeks. That means when you have a garlic product, any kind of garlic you buy on the shelf, chaotic garlic, that is on the shelf, there is no more substantial amount of allicin left in it. This includes also the article that I have in the handout, on using Dr. Zhang's garlic. We studied it. When this thing is 4 weeks old, there is no more allicin in it. The only way to get the benefits from garlic is to eat fresh garlic or to use freeze-dried garlic. And freeze-dried garlic is a patent held in England. There's only one company marketing it here. It's called Pharmax. They're down my area. It's a 425 area code. It's a fantastic product. And I show you a case in a little while that is just unbelievable what it does to people if you give that over time. You knock back all the bad bugs, and then we give healthy bowel flora. Hold back. Healthy bowel flora is another one that you need to know. When you take acidophilus on an empty stomach, you got 100 million bucks going in, you got 2 bucks going out. Because the hydrochloric acid destroys it all. When you eat, your pH in the stomach moves from 1.8 to 4.5 to higher. If you eat healthy flora on a full stomach, you put 100 million bucks in, 100 million come out on the other end and fertilize your gut. That is not known in this country for unknown reasons. People have been taking acidophilus on an empty stomach since eons of time, never having any benefits from it, wondering why it's not working for them. So when we give garlic, we also automatically give healthy bowel flora. And garlic is similar. Garlic, the alliinase, the enzymes, is destroyed in the stomach acid. And so garlic should also be taken on a full stomach. That is an important detail you need to know. To make these things work, you make nature work, you have to do it right. Yeah? You want to do antibiotics, you can take it sleeping, standing up, lying down, after meals, before meals. You do natural stuff, there is a rhythm to it. So we use freeze-dried garlic for detoxing, and we've seen huge amounts of toxic metals coming out in the stool just on garlic alone. There's a few other things. One is interesting here, because I was, I think, the first one to say this. Sauna works, that's long known, but electromobilization, I wrote a paper on this 5 or 6 years ago. You can sandwich an organ between 2 plates of an electric anti-tense unit and run a current through it, and the metals come out. And the same we found true, I call it photomobilization, by using any type of infrared device, putting on the skin. And Tom has already, like many people do, they hear a lecture of me, they put it immediately into their lecture also. That infrared light and other light devices are great to selectively mobilize metals from one part of the body. But my lecture is on infections and not on metals. This was just kind of, I was going to give you this. This is point 1 in treating of all infections, but especially in treating Lyme disease. Then I have you remove toxic emotions and memories. We have various procedures. I teach a thing called applied psychoneurobiology. Oh, Julie, do you have these brochures? Oh yeah, Julie back there, in case anyone's interested, ever taking a workshop with me, I brought some of my brochures and Julie has them there at the end of the thing. Then, okay, so very important is we found when people have unresolved psycho-emotional issues, the metals don't come out and the infections grow wildly. And the moment you deal with the emotional stuff, the metals start tumbling out of them as if they're not needed anymore, and the infections are much easier to control. Then we remove the stressors such as too much work. With Lyme disease, very, very important that people get regular sleep. If you have an executive who's got Lyme disease, they have no chance of healing from it if they keep doing their jet-setting life. Yeah, it's more so true with Lyme disease than any other illness that I've seen. Yeah, viruses, you have a flu, you work through it, you kind of suffer, take aspirin or so, you recover. You have a viral infection, you keep stressing yourself out, most of the time you get over it eventually, but not with Lyme disease. If you want to win there, you have to completely change your lifestyle. I mean, I'm talking to myself also. Yeah. Poor bite, I put here like with Lyme disease, since it sets up as housekeeping very much in the brain, spinal fluid, in this area around the jaw. When you have a loss of vertical dimension, that means the teeth are chewed down, they're flat, or genetically they're too flat. We found by just opening the bite up with higher teeth or making a splint, it improves the lymphatic drainage from the jaw, it improves the entry of our medications into the brain and into the jawbone in a fantastic way. We call this drug uptake enhancement. And one of the most important things is to look carefully at the bite. And the dentist experienced with the bite and do splinting kind of work or so, it is a huge, huge important piece with these chronic infections to get that right. And there's something I didn't believe, but I work with a dentist in Vancouver, Ara, some of you know him, who I send all my heart cases to. And it's just unbelievable the quantum leaps that sick people do when you just build up their bite. And all he does, he's not a genius, in that way. He just puts a damn splint in there, but he doesn't make a splint like other people do flat. He makes it like, quarter-inch high, like really juicy, thick splint. People walk around with that. When they eat, they take it out. Sometimes when they have to talk in a conference, they take it out, but they wear it most of the time. And the changes in the brain are instant. People get their memory back, memory loss being one of the main symptoms of all this. And the blood starts flowing again in the brain. Our antibiotics or antibiotic equivalents that we give enter the jawbone, and the detox gets 100 times faster. So that's a little important pearl for some of you. So we reduce the bowel pathogens, that's an important one, with freeze-dried garlic, the healthy bowel flora. And then there's one thing, when you give people garlic or any other sulfur-containing agent, like DMPS, DMSA, the whole amino acids that are detoxing metals, or MSM, you're loading the system with sulfur. And about 60% of people have a deficient phase 2 liver detox system. That's the liver binds toxins that it finds in the body onto sulfur, and they have to kind of go through these different pathways in the liver and then the gallbladder and then out. And when you give a lot of sulfur, the liver detoxes a lot. It just pushes out a lot more toxins, and we found that a significant number of people, when you load them with DMSA or with garlic or any of these things, they get well, they get much better over a few weeks, and suddenly it stops and they feel unwell and they go down in a different way. And what I'd overlooked was just that simple thing. And we give them grape pips or pro-anthocyanidins, and that immediately resolves. Within 3 days, they're back on track, and the detox continues beautifully. So it's a little, pro-anthocyanidins. There's grape pips from Allergy Research. It's 4 capsules twice a day, or Pharmax has, I think, the better product, but it's probably not that different. Okay, and then the important one for me is bee venom therapy. Now, I owe this one to Chris. Now, I was one of the first researchers on bee venom therapy in the 1970s. I wrote my first paper in Germany on it. I wrote a paper on it here in 1989 or so, a peer-reviewed paper on the use of bee venom for the treatment of chronic rheumatological situations. And at the time, I was sort of laughed half the way out of the community, for doing this. But meanwhile, and then Chris mentioned to me, and we realized, that I was treating all the things that looked like Lyme disease with bee venom. They seemed to be getting well, and I never believed in Lyme disease because the people that had those rheumatological complaints were never a problem for me, treatment-wise. Everybody got well. And so I never thought much about it. And then Chris turned me onto the idea and said, listen, Dietrich, I've seen this article in this journal showing that bee venom is a very effective antibiotic against Lyme disease. Now I have the literature cite in the article that's in your handout, my treatment of Lyme disease with bee venom. It's a journal, Clinical Journal of Infectious Diseases, a very good peer-reviewed journal that shows that melittin, one of the peptides in bee venom, has a dramatic effect in basically the spirochetes explode on contact with melittin at the finest subclinical doses, as much as the equivalent of 10 bee stings in nature, create a plasma level and a level in the CSF and in the brain of this of melittin, of this peptide, that all spirochetes in contact die with it instantly. And so I found it, I dug the article, I found it, and I went back more consciously this time around, treating everybody that I diagnosed with Lyme disease with bee venom. And the results are nothing short of dramatic and stunning and unbelievable. People, after usually 2 to 3 weeks, they basically feel 80% better, you know, much faster than on antibiotics. And the amazing thing is, we treat them for 6 months, and it's usually lasting. They don't relapse. Any lab evidence that we've ever had, disappears from it, and it is just nothing short of dramatic. I show you like a couple of cases on slides if you have the time at the end, but I want to get to actually doing a demonstration before it gets too late. WOB enzyme, that's Gary Gordon's translation of a German product. Just a few words on WOB enzyme. WOB enzyme is a proteolytic enzyme. However, it has a coat around it that contains a lot of secret undeclared ingredients. The company had to declare to the FDA only as this inert coating material, and then there's this enzyme. There's a zillion companies that have copied WOB enzyme, including some of the names I could mention. And what they copied is the proteolytic enzyme, but not the coat. The magic is in the coat. Yeah? All the Germans know that. And the company has never disclosed what it is in there. They didn't need to do that because it's a particular coating agent which doesn't need to be deciphered what's in there. So other enzymes do not do this. Yeah? And so WOB enzyme, basically what it does, like Lyme disease exists in cystic forms. It hides it creates this connective tissue kind of bubbles that it hides inside. It hides in sick cells. And the proteolytic enzyme basically welds all this open, melts all the debris, all the protein coatings, and exposes the bugs to what we're doing with our treatment. And it's fantastic. And you have to give a high dose, and you have to do it for a few months. And you have to do it on an empty stomach, because otherwise it starts digesting your food instead of being absorbed in the small. So the path from the mouth to the end of the small intestine should be fairly foodless when you take it. Otherwise, some of it goes to digesting your food. It's fantastic, it really works. Then we use the specific transfer factor, 1 to 3 caps 3 times a day. 3 a day is much better. We were initially disappointed, it's very expensive. If you give only 1 capsule a day, I've never seen an improvement with it. When you start giving 3 a day, you start seeing improvements. If you give 9 a day, it's fantastic. It's a fantastic product, but in my opinion, underdosed at the recommended dosages. This is just, however, if you put it in concert with a number of other things, you get the synergistic effects of it, and it's fantastic. Colostrum I use, or Gary Gordon's Immunity is a wonderful product to add in. So the transfer factor, you can get away with less of the expensive specific transfer factor if you add. Transfer factor is made to infect cows, pregnant cows, with the illness you want to treat, and then you collect the colostrum when they give birth, and the colostrum contains a specific transfer factor towards the illness. That's how these are made. Antimicrobial herbs, the main one is astragalus. Ozone saunas daily. There's a wonderful company in Canada, there's the website. They make the ozone tent, it costs like maybe $200. It's like just a heating setup and a heating element with it. It's very cheap. And then you can buy for another couple of $100 the cheap ozone generator. You plug it in there, you sit in this tent, it zips you up, you look like the Aborigines boiling you, sort of like you're in this thing on a chair in a tent, your head is out free, and you get the heat here and you sweat like crazy, and you get the ozone pumped in through your skin. And I found that the best way of dealing with the ozone issue, of really getting antimicrobial levels in your system. The other one is lymphatic drainage massage, very important. For the diet, we use the metabolic typing from Wolcott. No, we use Wolcott's system. Wolcott is the original guy. He wrote the book Metabolic Typing, and Bill Wolcott is a wonderful guy. He lives in my neck of the woods. He's a good friend now, and we use his typing. It's a little different than Crystal's, and I think a little bit better. Homeopathy, just remember the snake venoms are where the magic is. I have a little article here. I hope I find it. I think that says Lyme disease. Oh, here it is. You know, should be here. No, this one here. Yeah. Here's a great article that I just found that blew my mind. It's the fact that there is neuronal growth factor in bee venom. Now, for those of you who work with growth factors, just one little note. The amount in one average bee sting treatment of nerve growth factor that we are delivering, it's a substance that repairs nerves. When you have spinal cord damage or nerve damage, which you truly have from Lyme disease, there's nothing right now in conventional medicine that's available to heal it. In a conventional medicine, if you would buy the amount of injectable nerve growth factor that equals 10 bee stings, you would pay way over $1,000. For a couple of dollars, we have the same amount of nerve growth factor in the bee sting that we delivered. So it's a fantastic substance. This bee venom has some magical stuff in it that, you know, I have all the breakdown on one of the slides if you get to it. Now, all this said, the viruses, I have my antiviral program that we're using for the viruses. Mostly we do 2 oils. We do fish oil and coconut oil. We're upping the amount of that in people. There's a fantastic antiviral regime. We add in cilantro. It's the most potent antiviral herb for the herpes viruses that we found. I use thymus extract, Pro Boost, thymic protein A. Some of you know. Anybody know what the company is? Pro Boost? Vitamin Research. They sell it, yeah. We used to use from Women's International Pharmacy the frozen thymus extract, and it's probably still the most solid suggestion. You start with 1 vial a day, and then twice a week, and then once a week. I have also explored the use of Rife devices. Maybe I'd say a few things of that. Viruses are very responsive to the Rife frequencies, to frequency type of medicine. And the basic thing was mentioned before, the speaker before, and we've explored there's different machines available now. Some, you have hand electrodes that pump a microcurrent through you that's pulsed at various frequencies. Others use the Tesla type of light. I have that somewhere here on my thing. Let me show that to you. The first one I like to point you to, because Ed Skillings, who makes this one, was a good friend of Ed Orana and of this academy before he got busted by the SDA and they dragged him by his balls, through the desert and back, and he's a good old friend of this company. And his machine, I believe, is the best one I've seen so far. And the wonderful thing for most of you is you don't have to think. It's one setting, you put the thing on, you sit next to it, it treats you. And we've observed fantastic healings in some cancer patients and some of the more seriously ill patients, and it's a real winner. The other machine, the F-Scan, is going to be very popular. I put a little critique on there also. It's a hit or miss kind of thing. It's very effective when it works. And it has a diagnostic mode in it instead of muscle testing. It uses, has its own diagnostic scan built in where it runs through skin resistance kind of testing, and then any frequency that significantly changes the skin resistance is then given therapeutically. Here's a list on some of the more other antiviral agents that I use. Amantadine, I like. Homeopathic snake venoms from Sanum, Pleoquent. Needs to be given at high doses, at 10 drops 6 times a day. When you give the Sanum remedies, I don't know, for me, I've been a critic, I've been in favor of the Sanum remedies and a criticist of them. In the old days, it was enough if you gave like 5 drops twice a day of the remedies. Now, like with Pleoquent, as an antiviral, it's very effective when you give 10 drops 6 times a day. It works fantastic. But at the lower dosages, I had no success with it. Selenium, to make somebody toxic with selenium is a great treatment for viruses, but you can go over the edge and kill the patient. So it's like same with vitamin A. You know, those are the big ones. Again, garlic is a fantastic antiviral, and then there's a few other things listed here. I want to quickly take you through the treatment of an ALS patient. Those of you who treat ALS patients will take my hat off to me after you see this presentation. This is an ALS patient who looked just as bad as they look when they come in the wheelchair and the whole bit, and who got well with our regime. And I show it quickly because it makes all the points better than any other thing. And then we do a quick treatment on somebody. So her name is Julie Zizis. So 1996 was her ALS diagnosis. She had amalgams removed and so forth. Had DMP escalation. Now, this wasn't my patient until about August last year. Here's the letter from the Mrs. ALS Washington Medical School. Says here she has done considerable reading. Oh, where does it say? Well, oh yeah. I told the patient frankly that I do believe she has ALS. Now that's the best you get ever out from a medical school in terms of ALS diagnosis, unless the patient died and they do a post-mortem on the patient, then they say, yes, it definitely was ALS. But until the patient dies, at least in my state, we never get a neurologist say, yes, this is ALS. You know, I don't know how it is in other states, but this is how they deal with the legal issues in that. But this is as good as the main ALS lady in Washington State goes with her statements. Oh, Chris, would you help me go just rapidly through these, because I just want to rattle these through. Just to pull the next one here, and then just kind of always get the whole stack out and just put the next
These
one.
in order like this?
Yeah, something like this. But we don't have to look at all of them. So here's another letter, a white female with the diagnosis of suspected ALS. Again, this is Virginia Mason. This is sort of like in neurology, you know, the top of the ivory tower. Just to show you, this was not a muscle testing diagnosis of ALS. This was a real ALS diagnosis. Yeah. And hang on. Okay, this is just the nerve conduction studies, and so we don't have to go there. Okay, this is the patient in May. This was before I started seeing her. Just some analysis of how she was feeling. She was at the time in a rapid downhill slide. Pain everywhere, knee buckles while walking. No, while walking means she could, from her wheelchair, walk 3 steps to the toilet seat. That was her walking, you know, that she refers to here. And she couldn't do that walking anymore. She wasn't walking for 3 years, you know, at the time. Burning pain in both arms, weakness, cramping, difficulty climbing stairs. Again, climbing stairs, what she had in her house, she had stairs, there were 2 steps. And for the wheelchair, you know, she kind of had to get off the wheelchair, and then somebody carried the wheelchair up, and she had to maneuver those 2 chairs with the help of 1 person. And that was difficult for her. That was as much as she could go. We do brainwave biofeedback. I just put that in there as one of the treatments. We recently started incorporating as a wonderful additional tool I recommend to all of you. Okay, and then we get to the testing. Now in my testing, she had Lyme disease, and mycoplasms. That's what we found with the testing. Now, on all the tests, I just want to show it here. We did, this BBI was negative. We go through a couple of tests, and you're going to see they're all Lyme disease.
Those were, you had a positive test on the bottom of that, didn't you? Consistent with infection by Borrelia right here. IgM, IgG.
Yeah.
Oh, positive.
Yeah, but okay, sorry, yeah. She had this test. It was positive for Lyme disease here on the test, but the University of Washington says, well, this is not positive.
Right.
This is just one lab test, that is completely insignificant. Yeah. So she was taken through a couple of others. Let's just kind of go quickly through these that were more or less negative. There's a Lyme one that was interpreted, Western blot, interpreted as negative, even though she has one band there that looks positive to me. Okay, here's a couple of the chlamydia that were negative.
More same.
And here is a positive mycoplasma pneumonia test. Yeah, so this is, for me, MS is a combination, usually of Lyme disease and mycoplasma, or mycoplasma, ALS, mycoplasma and Lyme disease, and one or several viruses with it. Usually the three things have to come together. So, next one. Another mycoplasma was negative.
Mycoplasma back.
So, then we did the thing for the first time. I'm a friend of Mrs. Issels, and I call her when I'm in trouble, and she said, mycoplasma, no problem. Joseph developed a mycoplasma vaccine that we're producing here at the clinic that she's supervising in Mexico. So we had the patient get the vaccine. It's very simple. The patient sends some blood down, and 10 days later, they get these vials back, and they inject it once a week for 4 months. Now, this was like this. It was at first no response, and then more and more dramatic, her healing, her return of the neurological improvement with that. Yeah, they're all the same thing. So if you want to know about the mycoplasma vaccine, you can ask, would you show who you are? Just Mrs. Issels. Mrs. Issels, just kind of show who you are in case somebody wants to find out about you. That they, yeah, this is her, yeah. The mycoplasma vaccine is also fantastic for breast cancer. Yeah, I know for other cancers as well, but do consider this vaccine. It is less than $2,000. It's not cheap, but it's less than $2,000, and it saved so many lives. And it's such an important part to throw in there in the treatment. So here is now. The one thing I did, the mycoplasma vaccine, once she responded to that, I added in the bee venom, and it did an incredible difference for her. And currently, she has only one treatment. Twice a week, she injects herself with bee venom. That's the only treatment. And these are her improvements since the beginning of the mycoplasma vaccine and bee venom therapy. Swallowing 90%. Who of you has ever in an ALS patient seen a 90% improvement in swallowing after it was almost done? You haven't. I promise you, you haven't. There wasn't ALS if you've seen it.
That's how they die. Can't
Yeah,
swallow.
yeah. It's usually when they like this lady could hardly swallow anymore. When they're there, you know death is close. It's knocking on the door. You don't see a 90% improvement. This is her list. I didn't make this one. This is her list. You can read through the things. Twitching, cramping, depression, 75%, ear ringing, 99%. This is dramatic. I think I leave this case there. I just wanted to make the point. So what we did with her, she had the metal detox in the early days of her treatment that on its own didn't change anything at all. It was when we started treating the infections. And if you want to take one thing home from this conference, is that most or all neurological diseases are chronic infections. And she had the cavitations done before she started on this, and that actually sent her on a downhill spin. However, if she hadn't had them done then, she would have got the teeth out now, as the last bit. And that's pretty much what Chris also has done now, that we changed the protocol where we do the systemic treatment first. We make the diagnosis, the systemic treatment, and then we do the cavitation work, and then we extract the teeth. Yeah? Now there may be exceptions to that. Sometimes you can't get the patient well without doing the teeth first, because very often the teeth create what we call drug uptake and impairment. That means the very drugs you're giving to reach the bugs don't get there because the autonomic changes from the tooth. There's so much vasoconstriction that there's no delivery of the substance into the jawbone. Then you have to do the teeth first. But as a general rule now, we at least giving the patient a good portion of treatment first with the anti-infectious agents and the metals, and then we do the teeth. So, Joanne, would you come quick? We're just going to spend 5 minutes more, Chris, on just demonstrating the thing. I think my time is up, isn't it? Yeah. Okay. Joanne, would you come now? Joanne already told us, that she has had the diagnosis of Lyme disease, and she told me that she had several hip. Let's get a chair here too. Doug, would you be my assistant? Yeah, just so we can. So Joanne had how many hips did you have? 4 hips. So she's
only
on the
2 replacements.
Okay, she
In
is
2
on the
years.
second. She's within 2 years on the second hip joint, and had 4 surgeries on it. And for me, I've done a lot of hip follow-up care. That's Lyme disease unless proven otherwise. And the treatment for that, with this kind of condition, it is so, I have never seen a case fail, getting the patient completely pain-free within 2 or 3 treatments of doing a combination of neural therapy and B-venom therapy. And so I don't know if it's going to be true for her, but I show you how our diagnostic workup works and sort of comment on that. Now, Doug,
Yes.
would you be actually, why don't I have you do the treatment and I comment on it?
Oh, okay.
Yeah. Would you do
Right, yeah.
indirect with Rennie?
Sure.
So it allows me kind of to say, Doug Phillips is one of our top dentist guys. He's from Florida, and he uses the same kind of testing that I do. Rennie is an interesting character because she worked for many years with Chris, and then we met, and Chris and I worked together in the same office, and then Chris left, and I kept Rennie. And we all know each other, very well. And Rennie has been one of the most fantastic practitioners. Learning from all of us, and probably beating all of us because she worked with the best doctors in the world and learned all their tricks. And she's now on her own in Santa Fe doing wonderful work with this. And so, okay, so why don't you do a regulation first?
Okay.
Yeah, so Doug is going to first check if Joanne's autonomic nervous system is in a state where it can disclose stresses. So he first does a test that we've developed that shows when the body is in acute stress, and that looks okay. These are just some pre-tests that are not important for you, and you won't learn much from this unless you know the ART test. It's called ART, the system, like ART, autonomic response testing. So now she's going to put her hand on her belly button. This is a test, again, to show, to curl the fingers backwards. This is a test to show if the autonomic nervous system can respond to a healthy input and is not responsive. She's blocked. We call this blocked regulation. And this is in our system the most important different things from any other EAV or muscle testing system, that we first look, can the system really respond or not? Can we communicate with it? And Doug is now placing different things on it. These are monoclonal antibodies towards various infections, and he's placing that on her, seeing if that changes the test. And it doesn't change the test.
She has her paw on her claw.
Right hand.
Why don't you just open the damn button? Joanna's not. Are you kind
You
of
didn't tell
crude?
me I was going to have to strip.
You want to come up?
So this is in our system. The most important step is to see what unblocks the patient. Just try the metals for a change. I have everything back in that box back there. So things that block the system can be food allergies, but most common would be infections or heavy metals. got the PCA. Oh, hang on, I got the spray here, the heavy metal spray. The metal-free sits around somewhere here.
Cilantro. Here's cilantro.
Okay, yes.
I'm not trying the metal-free spray. I was just, the PCA is in there. This little thing of PCA. Feeling the time pressure.
I want that bee sting.
Oh yeah, no, you.
Now what is that?
That's PCA, that's what he was talking about before, that's the spray.
You have Borrelia also? You have Borrelia?
Yeah, we have monoclonal antibodies for Borrelia. Yeah.
Already put it on.
But it's usually like one of the other things that unblock people. Okay, so she's unblocking the DMPS. That would mean that she would be well advised to have a couple of DMPS shots to remove the heavy metal burden. Let me say some interesting thing to this. It was alluded to before. You know, we know the old treatment for Borrelia was to give mercury, and actually high levels. You created mercury toxicity to stop the growth of the Borrelia. And what we found, and I discovered Borrelia the other way around. I detoxed metals from people, and suddenly the Borrelia would go wild, and I didn't understand it. You know, people that I didn't know had Borrelia. Suddenly Borrelia was everywhere and kind of creating symptoms. Doing the detox, the people were symptomatically getting worse. And what I was simply doing, I was taking the treatment away by detoxing them. Now, artificially, induced mercury toxicity is not a great treatment for Borrelia, and certainly shouldn't be used as a treatment in the year 2000, or 2001. That was then, but actually many of you here are treated for your Borrelia by daily doses of mercury from your fillings. So the moment you start detoxing, you have to watch out for that. People during the detox that get worse, very often as pathognomonic for Borrelia. And then you just shift and put one of the other agents on board, like garlic, to keep it down. Okay, so number one, it means she's got some metals on board. They should be addressed like in a more aggressive way than you have, because DMPS is our more aggressive agent. We could go slow, could just do the metal free at this point, and within a few weeks also she would be at the same point. It's just, I like aggressive. Okay, so now she's got open regulation. She has no immune dysfunction.
Want to go into the jaw?
Now go, well, her main problem is the right hip. Go straight to the right hip with the agents. Now Doug is going to scan the right hip, just seeing if you get a weak muscle. There is something there. So that means usually for us, there is, we said with the stealth phenomenon, stealth means it's an infection without inflammation. And in the muscle testing, it translates when we actually hold the area where the problem is, the arm goes weak, that there is some inflammation. If there is no weak muscle, it means there's no inflammation, but there can still be stealth pathogens there. And that's what most schools in kinesiology don't know. They kind of hold there, and if it doesn't go weak, it's okay. It doesn't mean anything. It just means there's no inflammation, which means usually things are worse, not better. So what you're going to do with the week? You're going to still just kind of do the direct resonance?
Do you want, whatever
Why don't you go jump straight to direct resonance and scan her for Lyme disease, top to bottom.
Okay.
So Doug is going to hold now. He's going to take the monoclonal antibodies. Oh, here, I got it here.
So let's take 10 nanograms, just so we don't miss any.
Okay, so he's going to take a monoclonal antibody, 10 nanograms of it for Borrelia burgdorferi, and hold it in his hand and use a little antenna to contact her to see if she has any resonance with it somewhere. And he's over there over the sternum, overlying the thymus, and gets a resonance there. That means there's some real bugs there. The left jaw is okay. So he's not finding it in the jaw right now. So whatever she's done seems to be good. I'm scanning the gut. some in the heart area, or the ribs or whatever, or spleen, whatever organ is underneath the wire.
Cardiovascular system is the target organ for Lyme disease.
Yeah, cardiovascular system is a target of Lyme disease, Chris says. And over the hip, very well, over the hip joint. Just go down the thigh, the whole femur on the side, because I'm suspecting, if it's in the hip, most of the time it will be an entire course, along the implant. So there's other areas in the hip where it is. Now this exercise, one could say, is all academic. Sure, now we know, okay, she has a couple of nests of infection that we can actually detect. But the wonderful thing is, against this test, we can test treatment, and that there's no other thing that gives us that so easily.
When you do your bee venom, do you use specific acupuncture points or just general?
I use both with the bee venom. I put in acupuncture points, preferably in the neural therapy, the scar injections and trigger points used. Okay, there's a little bit in the left hip joint also. Okay, for purpose of demonstration and shortness of time, let's just jump straight. So you have she holds the DMPS there. Here's the thing. So now we're going to test treatment, and no, let me just give you my favorites for now. So first of all, let's do this one here. I have no idea where the bee venom is. Let me find that.
It's over there.
So now the rules are simple. Anything that eliminates the resonance of the Lyme disease in a particular area would be a good treatment. Do you find anything so far?
Yes.
Okay, so the first good test we're getting on the VOB enzyme, which we typically get. And then let's test a couple of antibiotics. Tetracycline. Yeah, this is very specific, this kind of muscle testing, for the sensitivity of the microorganisms, because those we can check, with microbiological procedures, and we're always right on. Yeah, we get a bladder infection, so tetracycline does nothing for her, which is, doxycycline, tetracycline, would be. Now we get my favorite here, is Zithromax. And
It doesn't check for me all the time. I use.
not all the time, but
Sometimes it does. It changes all the time. You
Yeah.
gotta check these patients every couple of weeks because the bug gets sent.
the bug is changing.
You gotta have all your antibiotics.
The bug is changing, yeah. We have a whole box, like with 20 different antibiotics, maybe even more by now, that we check them through.
Dr. Whitaker said
Yeah.
the bug is very clever.
Yeah,
Knows
yeah.
it's being treated.
Yeah, my favorite right now is roxazolomycin. Is a European drug together with trimethoprim.
I'll have to move to Europe.
Yeah, this is bee venom, and bee venom is holding up very well for her. Yeah, so he's moving right out of that resonance. And the other one is freeze-dried garlic. I wanted to test, but I think I forgot to bring that. Freeze-dried garlic tests most of the time also. So, but anyway, my suggestions based on this is DMPS, chelation therapy. You get that together locally. We give you some instructions for that. Then wobenzyme, the normal dose, for 10 pills, 3 times a day. And then bee venom therapy. And the bee venom therapy I've got carefully outlined in my little write-up there that you have in there. But we don't have injectables here. We don't have injection needles here or so. But what I would say, what we do, I give you the number of my nurse, and she can just coach you on the phone. Oh, Doc, would you do it? Just coach her over the phone, to go through the bee venom. I inject myself with bee venom. I had Babesia lab documented very severe, and I was kind of, some of you who've known me over the last 10 years, I've sort of been on a steady sort of decline, and in the last year I've been on a dramatic sort of uphill course in my own health. That was when I started the bee venom, and I knew about the bee venom therapy for 20 years. I was one of the main guys that's never used it on myself. And so, And so now bee venom is also an antiviral and has properties against mycoplasma and other things, but it's not as effective with that. And you need to be aware when we make the diagnosis of Lyme disease, it doesn't mean that the Lyme disease is giving the patient most of the symptoms. It could be some of the, what the Lyme disease does certainly, it immobilizes your immune system. And then you get the secondary viral infections. And those are often causing the symptoms that the patient has. And by getting rid of the Lyme disease, your immune system doesn't come back necessarily because now the viruses have set up the housekeeping. But you need to always keep in mind when you treat Lyme disease to also address the viruses and the bowel bugs and everything. You give it a whole package of treatment, and then it works out really beautiful. So,
Thank you.
is it okay? Can we leave it there? Doug is the main guy. He knows the DMPS, forth and back. He knows all the other things. Thanks, Joanne, for letting us do that.
Now,
It's
what
just,
if
you know.
you're allergic to the bee
What,
venom?
yeah, what if you're allergic to bee venom? Now, first of all, there was a study in Brazil on 100 people that died from killer bee in, natural killer bee stings. And when you die of an anaphylactic reaction, it goes together with a certain biochemistry, a certain biochemical change, certain neuropeptides that are released, your blood looks a certain way. And they've proven in a study that none of these 100 people had died from an allergic reaction. All of them had died from a fear-induced reaction. They thought they were allergic, and they produced the entire course of events that led to their death. It's very common. Yeah? So, first of all, reactions to natural bee venom are very rare. Real, true anaphylactic reactions. And when they occur, I've seen one in 20 years of using it, and they're very easy to treat. You just give a little Benadryl. I inject calcium gluconate, which is a German way to treat it. You treat it like an asthma attack. Then you have the epinephrine syringe there, and use little. Nobody should use bee venom therapy without having. It's called an ANA kit. It's the kit that bee sting allergic people carry with them. You buy that. It costs $18 or so in the pharmacy. It has a couple of pills in it and a pre-drawn syringe, and you have that there as a safety factor. But otherwise, it's a fantastic treatment. Now, I want to just kind of give you bring it back to the jaw. Now, we found that with this protocol, basically, the Wobenzyme, the freeze-dried garlic, the metal detox, and the bee venom therapy, we've cured gum disease. Cavitations need more. Cavitations either need, in addition to really for the bone to fill in, need the surgery, which is still our gold standard, and we're all experimenting with other treatments that I discussed at other meetings. The infrared laser I introduced like 10 years ago was a very good tool. The anodyne is not better than the infrared laser, but a lot cheaper, and also works and covers a larger area. These are all tools that in addition can be used to, in my feeling, in my world, concentrate more of the nutrients that you bring on board in those areas. And then when you do go on and have the surgeries, they're much milder surgeries. The cavitations are smaller, they're easier to clean up, and they're not so much of a surgical headache. So it works either way, but often we still have to do the surgery, but the success rate has gone dramatically up in my world. And so I use the bee venom for all jaw-related problems, for all teeth-related problems. People have persistent dental pain. We use neural therapy plus bee venom. And so the gunshot approach to it.
The buccal membrane?
Well, I've used bee venom in the tonsils and stuff. And however, they can get kind of scary, swelling inside the mouth. And it's not needed because the peptides are released. You put it in the skin. Intradermal is the ideal way of doing it, just like the bee does it. That's the best way of delivering it. And they're being picked up there over time, over the next half hour or so, gradually moving around in the system. And there is no need in concentrating them in those areas because the melatonin is going to find the bugs wherever they're hiding, crosses the CSF. Garlic, the allicin, crosses the CSF like nothing ever did. With the studies that I reviewed, allicin crosses the blood-brain barrier beautifully and knocks out the bugs there in a beautiful way.
Anesthetics with the bee venom?
Hmm? Yeah, I always mix local anesthetic with bee venom to make it hurt less. Bee venom hurts. Joanne. Yeah, well, the freeze-dried garlic has the nice property that it hardly gives people any odor at all. Deodorizing garlic doesn't work because it takes the active ingredients out. But for you, you know, I would take like 9 a day of the freeze-dried garlic. It's more expensive than taking fresh garlic, but it's more socially acceptable that way. Yeah.
If you control the humidity and kept it in the refrigerator, wouldn't that extend the...
No, garlic will hold as long as it's in a clove, but the moment you chop it up and oxygen gets to it,
Yes.
the process starts, and in 2 weeks it's dead. Yeah. But you have time to eat it. You know, you make a meal, you chop it up. You have time to put the garlic in the meal, wait for the guests to come, eat it, and you still get the benefits from it. But you have it 2 weeks in the fridge, it's gone. Temperature doesn't play a role. It's just the fact when the cells in the garlic, when you open them up, the enzyme is relieved and the process starts. That's why kyolic and all these other things were all disappointing or never worked. And I never understood why. You know. Yeah, there's only one product in the world that works, you know, and so we weren't told that, you know. But the research is out. Yeah, please.
Which one do you want to be using? Why?
Which bee venom?
Which one, Michael's or Charlotte's? Why?
Well, Michael Simic's bee venom is is harvested in Calgary, in a very pristine area, and Michael takes the best precautions of making it clean. He functions like a pharmaceutical industry. The FDA uses Michael Simic's bee venom as a standard for other venoms that are used for allergy desensitization and so forth as a gold standard. And they check his product once a year. The FDA checks it for purity, for content of drugs, for the production, sterility, and all that. And so it has a high.
Actually, he has some kind of FDA approval.
Oh yeah, he has a very working, good, positive relationship with the FDA. Yeah, which was an important factor for me because I get asked this question a number of times from the authorities.
One thing you can do with garlic, if you want to take fresh garlic, is swallow a whole clove.
No, you have to chew it to release the allicin. So to release the alliinase that makes the allicin. So it needs a chewing process because many people that swallow the garlic clove, it comes out the other end as a garlic clove. Unless you're a dog, you know, with the hydrochloric acid of like 0.5, whatever the thing is, you know. No, you have to chew it. And that makes it socially less acceptable, you know, than the acid.
I understand the concept of trying to improve the immune system and the natural defense mechanisms.
No, wait a minute. None of the things I suggested here, I'm trying to move away from all the damn talk about the immune system, improve the immune system. I'm not doing anything here that improves the immune system. The melatonin in the bee venom directly kills the spirochetes on contact, not through stimulating the immune system and waiting for it to do the job.
Wrong choice of words.
And the allicin, the garlic, does not at all do anything for the immune system. It's a direct killing action on the bugs. Just to clarify that.
Wrong
Yeah.
choice of words. My real question is, if homeopathic mechanisms work, and you have a focus of infection in the teeth, root canals, whatever, and you don't address that first, at what place do you address it? You're saying basically treat the patient as the new process that you're giving us, and then at some point you'll take the teeth out.
Yeah.
The question is, how do you get to that?
We make the decision.
Yes.
Well, we make the decision in our system when we can no longer find the direct resonance between the monoclonal antibodies and the bug in the jawbone. That means for us, it's really gone. Yeah, the same with the viruses. When we're at that point, that's when we do the surgery. And it may not, you know, and I don't know, Chris, how do you make that decision? I mean, I know it's we're all sort of eyeballing the issue a little bit too.
I think you're right. You still have to treat the infections first. You're absolutely right. I'll take an ALS patient, I'll do neural therapy on his mouth, and I'll do like a quadrant at a time and I say, how do you feel from that? Do you get any change anywhere? and you'll notice aches and pains maybe go away. And then I'll do like a quadrant at a time, and slowly do that while I'm trying to treat everything at once if I can. So don't forget, I keep my patients on heavy medications for a long time, so I'll do a quadrant here and then a quadrant here. I don't see much change with cavitation surgery on ALS, and ALS in particular. I don't think it's as big a deal as you're saying. I agree with you. It's the Borrelia and it's the viruses and everything else. But it's part of the infectious process. You got to get that out because it's also causing demyelination, and part of the disease process is demyelination, but in particular from the spirochete. Of course, you get spirochetes in here too. I don't see great shakes with the cavitation surgery, and I tell patients not to expect as much as with the infectious protocol that we're doing here.
And yet, you know, you don't get the patient well without getting the teeth well, you know. It's just basically, I mean, we're always saying at this meeting is all of us have moved the point of surgery further back. And we start with the anti-infectious protocol and the metal protocol as early as we can get, and then move the point of surgery back. And I don't think any one of us has a patent kind of solution. You know, we have our muscle testing routine that we follow, and that looks very, very good right now, you know, to use that as an orientation. However, there is certainly some teeth, you never get them clean, but you don't get the spirochetes out, especially root canal. You cannot get the spirochetes out there with no protocol other than pulling the tooth, you know, and so those sometimes have to go right away. You know,
how many bee, on your ALS patient, how many bee stings per day or per week did you work up to, and where did you put them?
Well, this protocol is in your hand now. There's a new protocol where we only do. No, it's in this thing here. Chris showed it. So it's in this blue packet. Yeah, it's in there in the back. Yeah. And some of the things are not accurate anymore. I recommend like a garlic product in there that I got, you know, from Dr. Zhang on the internet because he was big on Lyme disease, and then we had a lab in England examined his product for allicin content. There was no allicin left, you know. By the time it got to England, there was no allicin left. So it's like, you know, yeah, when it's produced, it has a lot of allicin in it, and then 2 weeks later, there's none left. By the time you use it, or the patient uses it, it's all gone. So there's a few changes, but the basic use of bee venom is in there. We use the equivalent of 10 stings a day. We used to go up to 100 a day, yeah, and now we discovered this thing that I call synergy. By surrounding it with other things that work in the same direction, we can work with much lesser doses. The patient doesn't get sick, they can do it themselves, there's no risks, and it's much easier.
Where do you start? I'm sorry, where do you start? How many per day do you start with?
I start with 0.2 cc's a day, which is equals 4 these things in nature, and then work it up each time 0.1 cc more until I'm at 0.5 cc's. So in about a week, I'm at the full dose and stay there until the patient is well. No, every other day is the best schedule. And minimum is once a week, but really like it takes forever with once a week. Best is twice a day, every other day initially. And then when the patient is pain-free and 80% improved or so, then we go to like twice a week or once a week until they're all done. And most people then sort of stay off it, you know, for a few months. And should there be any recurrence of symptoms, you do with the first symptom, do one treatment, and they're good for 6 months again. You know, it's like very amazing once you get there. George.
Excuse me, does chewing the stuff inside the bee's home, I forgot the name of it.
Propolis, yeah.
Yeah. Does that help it?
Yeah, George asked about other bee products. We have a little Michael Simics, you know, if you buy the bee, it has a little test kit with all the basic bee products, roller jelly, propolis, and so forth. And propolis, there's a lot of good peer-reviewed studies. Yeah, that's how it looks like. Propolis has a lot of peptides in it as an anti-infectious. Propolis is the glue the bee uses to keep out microorganisms from the beehive. It plasters all the holes shut with propolis. That's what that is. It has very strong anti-fungal and antibacterial properties. Yeah, so. Oh, yeah, sorry, yeah. It's a good idea to add all that in, but you know, I'm not you know, not trying to sell it, I'm not trying to reduce it all to the minimum program, you know, but most people that use bee venom use all the bee products along with it, and it seems to round it off a little bit. Yeah. But I'm sort of like Chris, I mean, I'm happy if I have the three main things that give me a punch, that's what I do. Yeah, oh yeah, one other thing that I forgot to say that's really important. When you treat chronic infections, I consider it as dangerous loading people up with all these supplements that you guys are doing. Because what you're doing is basically you're feeding the bugs that you're trying to kill. And in an uncontrolled way, for example, the B vitamins are used by most microorganisms as growth factors. We heard this morning that steroids, you know, artificial steroids are growth factors. I dare to say, those of you who do growth hormone here in the room, you know, that you're gambling with your life, you know. That was the very thing that killed Joseph Isles, you know. He got on growth hormone, and 3 months later, or a few months later, you know, he got a flu and died from it. I'm sorry, you know, to say it in your presence here, but I have a very strong judgment about that, because all these viruses and microorganisms came on board only like the last 10 years. And if you have an active viral infection and do growth hormone, it just, you know, it depends on who gets nurtured first. Is it your immune system that kind of goes up first, or is it a viral count that goes up first? And it's a rat race, you know, who's going to make it first. So I'm against, right now, when we treating chronic infections, I'm very, very sparse, I say, with what I give in terms of supplements. I think it's a dangerous thing to load people uncontrollably up with all this stuff that we give them, and very often it will create a growth spurt of the microorganisms. And one other thing with that is important for you to know. A good study that Swiss scientists did about 40 years ago, they went to study a group of aborigines on some island that lived only off sweet potatoes. And these guys, the guys were all over 6 feet tall, muscular. They looked healthier than any other population group on the planet. The only food they had was sweet potatoes. And they examined them and figured, well, there's no protein in sweet potatoes. There's no this and that in sweet potatoes. And what they found out, that these guys had microorganisms in them that were manufacturing the amino acids out of the carbohydrates, the amino acids, and every other thing that these people needed out of one food source. And now I'm asking you the question, who of you knows what your microorganisms are doing with all the vitamins that you're eating? None of you know when you take something orally what arrives in the bloodstream. None of you have any idea what you're doing. It changes when you do IV vitamin therapy, that I'm all in favor of. Yeah? IV vitamins, or if you use colorectal vitamins, you know, from allergy research as a good alternative. But the moment you eat vitamins, you have no idea what you're getting. Yeah? What actually, by the time it's gone through your thousands of different microorganisms and fungi in the gut, by the time they're through with it, you get the leftovers, and you have no idea. Most of it is poop. There's bacterial poop, whatever it is that they kind of made out of what you gave them. That's what you're getting. And you're calling it vitamin C or, you know, thiamine or whatever, you know. You have no idea what it is. Chris?
I don't know if people understand the significance of what Dr. Klinghardt did with this patient. He saved her life.
The significance of what Dr. Klinghardt did here is incredible. ALS patients live for 3.5 years and they die. That's it. You go to a neurologist and they say, looks like you have ALS, go home and get your affairs in order. So they turn off the switch in the brain anyway. So then you got to take a patient like you did and turn the switch back on, first of all, get the immune system going. And he diagnosed what was wrong with her. And do you think our profession would say, nice job, you saved her life? You're a quack, those tests can't be right. Yeah. And he saved her life. They've been in my office, they cry. When they die, it devastates the family. I've lost a couple patients like that. And then you check the whole family, because most of the family has Lyme disease. The kids do, the mother does, and you can save them. You save that person's life, and nobody understands it, do they?
Yeah. No. Thanks, Chris. Thanks, guys. I think we want to wrap it up. Okay, Isa, you get.
I just want to add with regard to the vaccine, I have to correct, it takes 1 month to prepare the vaccine, to punch it.
Okay,
so
it takes 1 month, not 10 days.
Yeah. And
Okay.
it works with all kinds of immune disorders.
should have all the phone number so where you can get the mycoplasma vaccine. Any cancer case, you should consider it. You know, and in any of the severe neurological diseases, you want to do the mycoplasma panel. Also for chronic fatigue, you know, the Garth, what's his name, Garth Nichols. He was here last time, I think, at our meeting. Any of the mycoplasma-related things, you know, because it's either 1 year on antibiotics or one damn vaccine, you know, and the year on antibiotics costs the patient far more than the vaccine costs. And there's no candida, there's no side effects on the antibiotics, you know, it's a vaccine and it does the job reliably. And I think it's a fantastic thing that should be done more. Okay, thanks for listening in.
So the light.
You announce what the next thing is.
Before we leave, any exhibitors like to come up to say anything?
You and Chris and George and Doug.
Couple minutes, Flo, can you make it real short?
Phil, I wonder if
We
he's
start at 8:30 tomorrow morning with Gary Bassett. That's the detoxification pathways. Carol, am I missing anything?
I need to catch a plane. I need to kind of pack my things.
David Russell's on tomorrow after Gary Bassett. And then we have the panel discussion like we usually have. We'll try to break up about 1 or 2. And if you have any questions, make sure you bring them all tomorrow.